so we need to be active. Please come in and be at your table. I will invite our panel members for the last panel, last of the 3 thematic panels. This panel is on actions. So we did awareness as the first one, then was financing, and now it is actions. What actions are needed to achieve the UNHLM targets? And remember, the question was what I would do, right? So we will reflect on that. I want to invite the panel members, Dr. Carl. Dr. Carl, please come to the stage. Dr. Carl is the National TB Program Manager for PNG. Please give her a hand. Anand Date, CDC US, please. Then Chameroon, please, from Kana, Cambodia. Then we have Kins from Dopasi, Pakistan. Then we have Janice from PhilCat, Philippines. Then we have Honorable Robert Naguri from PNG, Member of Parliament, PNG. And then we have Romeo Lazo from Philippine Medical Association. Romeo. Sorry. What was the name? Lazo. Do you know the Dr. Rozo. Sorry. Roger Dazo. Sorry. Okay. So, this is the panel on what actions need to be taken to achieve the UN high-level meeting commitments and targets. So maybe we start from you, Honorable. Can you tell us the first round of questions will be to all panelists what you heard in the group, and then the second round will go into your personal action, what you would like to do. So, Honorable, please, what you heard in the group.
Thank you very much. Good afternoon, members of the TB Caucus. It's my pleasure to represent my government and my country to be sitting here in this panel. From this afternoon's discussions, the 3 areas that I would like to make a few comments on a fight to end TB. Number 1, we're looking at the big picture. Number 2, inclusivity. And number 3, the role of members of parliament. When I talk about the big picture, it's the importance of perceiving region alongside country. Most times we come to such gatherings, we go back to our own countries, and we concentrate on our individual countries. I would like us to think in a more region. Think about our region, the Asia Pacific region. In the case of Myanmar, our brothers and sisters in Myanmar. They're in a situation where they don't have a government. They have a military rule, and they need our assistance. They need our intervention. We have to help them with this fight, because if we don't, it doesn't matter the number of resources, the time that we spend, TB will still prevail in Myanmar and then spread to other parts of our region. So we have to be inclusive, we have to think about the region in this fight. Number two, the translating global targets into national, local, district level. The knowledge gap, consideration, a focus on your constituency or your province or your district, matching your interventions to the pre-existing data. Messaging the insight, the numbers of proof, and conducting messages and convenings. Now, what I mean by this is that I, as a member of parliament, most times I don't have the time to look at the data, any data in this case. So when I am presented with the data for my district or my province, it raises alarms in my head. So if I'm given data and telling me that this is the number of TB cases you have in your district or in your province, then this makes me want to spend time, resources into fighting TB. If I'm not provided that data, I would think that everything is okay, I'm all right, and I'm looking at other things. So it's very good for us, members of parliament, to provide us data and tell us the problem that you have so that you can put money and time into it. Finally, the role of members of parliament. I, as a member of parliament, I am very lucky to be involved in this high delegation meeting. I would request for us to involve more members of parliament in meetings like this, because I have access to speak to my head of state. And I don't think most of you have access to your head of state. The more members of parliament we involved in such gatherings, we will get our heads of state involved. We have to get our heads of state talking about ending TB. Only there and then we will get assistance from our donor partners to fight this. So as members of parliament, for me, I'm going to make it my business after this meeting to get straight into business, to sit down with my head of state, my prime minister, and put to him the fight that we are fighting. And that is a commitment, personal commitment from me. Finally, I would like to share with you my personal experience since 2017 when I became a member of parliament. I heard about the multi-drug resistant TB in my country, and it scared me. It really scared me. So I started this fight in 2017. I built one health facility, and we were very lucky to be given a gene expert machine, only one in my district. And we placed it in a health facility. And we have a trained personnel that knows how to handle gene expert machine. So what we do in that health facility is that whenever we diagnose someone with positive TB, we do not let them go home. We keep them in the facility. We keep them as long as it takes. And we make it our business for their family and relatives to come and visit them, bring food for them, whatever they need. That's their family's responsibility to come and visit them. So we have 100% TB cure rate in that facility. And I really want to share this experience with you. It's a very practical thing to do, and if I can do it, I don't see any reason why you can't do it. So if you want to be serious with this, let's start doing these practical things like I did, and now I'm sharing my experience with you all. And finally, I think we must believe with more conviction that yes, we can end TB, but instead we must say, yes, we will end TB. Thank you very much.
Thank you, Honorable Robert Naguri. Thank you for your commitment also to mobilize the head of state. We are fully behind you, and we look forward to PNG taking the leadership of the TB response at the head of the state level. And any support you need in that direction, we are here to support you. And I think some interesting things you said, data to parliaments. very important, data to parliaments, not just data to how it is reported in the countries, but data to parliament to value and to value TB and spend time on discussing TB. Let me go to next to Janice. So Janice, you were in the group, so if you can just highlight a few points that the group discussed, and then we will come later for you as PhilCat, as a private practitioner, your perspective. Yeah, go ahead.
So thank you very much for this opportunity. I am sharing with you the output from our group, Group D. We were composed of representatives from the public and the private sector in different countries in Southeast Asia. So I think we all agreed that we are now emerging from the COVID-19 pandemic that has reversed the gains in TB control. The COVID-19 pandemic exposed the weaknesses of health systems globally, but it also taught us many valuable lessons. So during the pandemic, seemingly insurmountable tasks were accomplished successfully through genuine collaboration among diverse stakeholders, effective government policies, adaptive research methodologies, and innovative technologies in the diagnosis, prevention, and management of COVID-19. So one important lesson that we learned from the pandemic is that effective tools and strategies can effectively curb a deadly pandemic. We should treat TB as a pandemic. TB should be prioritized with allocation of resources necessary for us to end this pandemic that has claimed many lives, particularly in countries in the lower and middle income settings. So our group highlighted the following, what we should do to achieve our targets and commitments. We should highlight TB again and put it back in the agenda in the national, regional, and local settings. We should intensify case findings, and we should look for the missing cases. A big proportion of TB patients are with the private sector, and the response of the ministries of health should not only be for the public sector, but also for the private sector. There should be a paradigm shift in strategies for finding the missing cases. As one of our participants said, a health minister from India said that we should follow the people. If there are more cases in the private sector, then TB services should also be provided to them. So in many countries, patients also prefer to be managed by private physicians. Therefore, the TB programs should develop strategies to increase access to diagnostics and treatment services by patients in this sector. On the other hand, the private sector should also be fully engaged so that they will understand their role in TB control. One of our participants also raised the importance of the local government units, because the local government units in countries like the Philippines, where the health system is devolved, have jurisdiction over both public and private health facilities, and they can significantly influence provision of health services in both sectors. The LGUs should be informed, as our colleague said here, of the data, so that they can own their health programs. There should be case-finding activities also in populations that have been neglected for many years in our programs, such as slums and rural areas. We should already be able to link TB programs with other disease programs such as HIV, diabetes, smoking, nutrition, and immunization to maximize these programs and also for case-finding activities. Case-finding can also be done in non-health sectors such as transportation and housing, and linking TB to non-health programs like environment degradation can increase recognition of TB needs and also will increase TB funding. Involvement of these non-health sectors in TB programs should be highlighted in the local and also in the national setting. There should be proper coordination and communication between the legislative and the executive bodies. TB policies should be widely disseminated and properly communicated to all stakeholders in the national and the local settings. One participant in our group mentioned that TB preventive treatment uptake remains poor because of confusing messaging, even from Stop TB and WHO. So it's really a challenge, not only for national and local governments, but only other stakeholders like World Health Organization. There should be clear messaging on TB preventive treatment to combat what our group said, TPT hesitancy. Similar to COVID-19 vaccine hesitancy, there should be a communication strategy targeting communities, healthcare workers, and policymakers. TPT implementation programs should be able to sustain continuous supply of medications and also establish clear reporting procedures. Another point raised by our group is having a clear roadmap for social contracting and also having clear provision for patient support services. And an example is that having like programs like provision of food baskets and nutritional support for TB patients. We also emphasize that there is really a need to expand new technologies for diagnosis and treatment, especially in the lower and middle income countries, and that there's a need to accelerate research and development of new treatment and diagnostics through clinical trials. Lower and middle income countries should be capacitated to do good research. And TB programs should determine a research agenda and fully support the operations, or rather, the operationalization of this research agenda for their countries. So that's the output of our group. Thank you.
Thank you, Janice. That was quite a lot of things. And what you said is very correct, that we should treat TB as a pandemic and with the same urgency as it was done for COVID. And many important things recommended, and people actually committed to do themselves some of these things, including from the private sector, TB care, to local governing LGU, local authorities, and other case finding activities, as well as the TPT hesitancy that you highlighted is a barrier, and social contracting, new technology, etc. So now we go to KINS. Tell us about your group.
So the group was in actions, and right on the time when we are concluding towards the meeting, we had our awareness, financing, and now talking about the real actions that need to happen in order for us to end TB, in order for us to really conquer this last mile, do this last stretch. We spoke about a lot of things, concluded on a couple of key interventions on the actions that the group committed on doing as soon as they go back. Inclusion of costed action plans, costed CRG action plans in the national strategies. Advocacy to reach to their domestic, to reach their decision makers for domestic funding. Disaggregation of the UNHLM targets up to the district level. We see that our country has this 5 million targets, and this is a big figure. We might not be able to reach that, but if we disaggregate it to literally every facility level, the granularity of this will actually make this happen. Collaborations across the financial partners, like we spoke in the last panel, to really explore synergies. Yes, a hell a lot of investment is not going to come in a day. However, synergies to really drive towards the agenda. And activism and volunteerism, we keep talking about volunteerism. I don't work for free, I take a salary, but when I talk about community engagement, community monitoring, I expect the communities to work for free. It's, yes, volunteerism needs to be there. However, we need to really empower the communities. We really need to enable the communities to work. So more investment in community-led monitoring, more investment in community empowerment and community engagement, the group committed to assure that community needs and community voices will be at the left, right and center of our response, and together we can surely cross this last mile to our actions and NTB.
Thank you, Kins. You highlighted some important things there. Yes, please, some applaud for this group. You highlighted community, the need for investment, the CRG action plans, costed action plans, and also the very important thing is this, we talked about global target. And in my presentation, I also talked about Stop TB has disaggregated the global UNHLM target to country level. And Kins, what you said is going even one step further, how the country level targets can be disaggregated further to provinces or states or districts and health facilities. And that is how accountability and monitoring and how we can make progress towards the target. So very important things there. So now we go to Cameroon. Please, your group perspective.
Thank you so much, Dr. Sahu. For my group, we have a mixed and a diversified participant from government, civil society, and affected community. And in our group, we discuss about target and commitment that highlighted by political declaration, and it is very clear that target and commitment for prevention, for treatment, for funding, but there is a very important part of achieving these three. It's also linked to commitment for CRG. That is very clear, and agree with our sister just mentioned, achieving those target and commitment. Very important that CRG have to be effectively invest because the community who are living with the disease, they're the one who know, they're the one who support the country to achieve what already agree within the political declaration, and importantly, how this target and commitment down to country. So that is very important. The other aspect that the group also discussed, whatever we discuss in very high level, at the global level, at the regional level, but make things happen is at the country level. So very important that the leadership of the country, the ownership of the country is really, really critical, and that is also aligned with Excellency Dr. Mao mentioned this morning. We need to work together. We need to build partnership from the global, regional, and to the country. To make sure that our leader pay high attention to TB and put investment for TB, and that require a strong and effective partnership together from this part of momentum. We need to break the silence, we need to build awareness, and importantly, we need to obtain a very high political attention and political will. In the other aspect that also key in our discussion is about monitoring the last commitment that clearly mentioned in the political declaration is commitment for CRG, and that in that statement very clear mentioned zero TB stigma. This is something very important. Why can we not achieve the target? Why can we still having people missing from services? Why services missing these people? Who are the last mile population? How much it linked to stigma and discrimination? So that is very important, and we need to have a robust and routine system to make sure how it better monitor this kind of thing, and importantly, bring those people to the services. So it is clearly important that we need to have a better rolling out of One Impact CLM, which led by the community affected by the disease, to take on board, and they're the one that can support, knowing what is the situation, what could be the result and progress from time to time. So that is what discussed in the group. And the other aspect is we discuss about how can the existing platform can support building the discussion to make sure that it moving from the talk to action. And there are some platforms that already exist that can have a match up of people where we can sit together between service provider, politician, and community. For example, we do have a platform of CCM that's supported by the Global Fund, and this should be used as existing platform to discuss further of how can we review the progress, what our head of state agree in political declaration, and then try to work it out. What is the funding gap? What do we need to do more? And that is something that we have already have a mix of people sitting in the same table. It's like what we did here in this kind of platform. It needs to further strengthen to make sure that this kind of result can be achieved. So this is something that our team have been discussed. And for the case of Cambodia, we already planned together with our regional partner APCASO and with support from the Stop TB Partnership, and especially under the leadership of our delegation, Excellency Dr. Mao is here, NTP is here. We plan to do some sort of what we call post-UNHLM meeting from the 19th to 21st June to further discuss within our country, but also we try to bring other partners from the region to make sure of how can we better exchange our learning across the country, but importantly bring our leadership, especially Minister of Health, Minister of Finance come together and discuss and how we can better move to achieve the target by 2030. So this is very critical, and hopefully we could use that momentum to bring to the high level, including our First Lady and also our Prime Minister if possible. So Excellency Dr. Mao is here, he already made a promise that this can happen in Cambodia in June. So once again, thanks a lot, and that's what discussed in the group. Thank you, Dr. Sahu. Thank you.
Thank you, Jamaroon. You made some important points there. I think this country level leadership and ownership and the commitments also for your own country, Cambodia, and also this platform that you talked about that brings together all stakeholders at the country level, and also the political commitment that is needed for CRG. So now we go to Anand. So Anand, please, your group.
Thank you, Dr. Sahu. So I was in the same group as the Honorable Member of Parliament from PNG, so I will try not to repeat the same things. So I'll just mention a few things broadly. I think this session nicely brings together the conversations that happened in the earlier groups, which was about awareness and financing. I think those are the building blocks, and then how we go about achieving the UNHLM targets. So I think first is, and then a lot of things have been said, how do we make awareness, and then the targets have been split by country, how do you split that at the lower level, etc. I'll just make a few points about, awareness is important, financing is important to achieve all the targets that we have made. The most important thing is acting upon those targets, and then it has to be done in a comprehensive way. Just to point out that even before COVID, if you look at the trajectory, and Dr. Sahu showed the graphs yesterday, we were supposed to be, there are milestones set for different incidents, TB incidents and TB mortality targets that are supposed to be achieved. Ultimately, we have to end by 2030, 2035, the SDG and NTB target, but there were milestones set for 2020, 2025. So if you think about a minute, even if you remove COVID, so there is a big gap between where we were supposed to be and then where we are. For example, by 2025, the expectation of incidence reduction was by about 50%. We are at 9%. The mortality reduction was by 2025 75%. We are at only 18%. So just to say that COVID was a nice, it's a good soundbite. Yes, COVID affected TB programs a lot, but I think even without COVID, we were far off in terms of achieving some of the milestones. So I think moving forward, now that we have these new UNHLM targets, unfortunately, we did not achieve the last targets. This UNHLM goes to 2027, and then only 3 years will be left to achieve the SDG targets. So I think we are running out of time. So most important thing is, it has to be a very comprehensive approach. There are some numeric targets, and there are a lot of other targets in terms of the stigma and policy, etc. We don't have the luxury to look at targets one by one. In 2027, we cannot say, oh, we achieved the case finding targets. It looks like the 2023 data looks, we are at 8.2. 2024, we will be identifying 9 million cases. But then what is happening with the rest of the TB response? We cannot just say then pat on our back that we identified a lot of cases. If we are going to achieve the case identification targets, we also need to ask the tough questions. Then why are we not doing contact investigations among all those individuals identifying TB disease, and then why we are not providing TB preventive treatment? So I think it is very important that we don't get, targets are important, but we don't get caught up in those targets too much. It has to be a very comprehensive approach. And then it has to be monitored on an ongoing basis. Another thing I would say that we have a lot of new tools that are available. If we are going to achieve these UNHLM targets and end TB targets and sustainable development goals, those need to be adopted. One example that I think Elliot gave was BPAL. In 6 months, once it became available, there is a lot of uptake of BPALM, but there are a lot of new tools, new diagnostic, new approaches, new treatment regimens that are available even now, which are not scaled up and adopted. So we cannot be just focused on one target, because if we have to realistically, and the 2027 unit, those are ambitious targets. It's going to be a daunting task to get to those. But we need to make sure that we are adopting the new tools and then make the whole approach in a comprehensive fashion. And the important thing of that will be use of data. Targets are important, but they should not be an end in itself. There might be arguments, Stop TB has divided targets by countries, sometimes the estimates are not correct, so we should not hide behind those excuses. If the estimates are not correct, we should try to find what the real situation is, use the programmatic data, and it should be a dynamic process so that we are implementing, collecting data on an ongoing basis and looking at it and put it into action, tweak the program as necessary, so we can actually keep moving forward and realize the goal of achieving these UN high-level meeting targets that have been set together. So I think, if I had to summarize it, I think the awareness, everyone has talked about it, how we need to socialize the targets in more and distribute them. I think the assets or finances are important in terms of implementing those. Action is important because we need to take the awareness and finances and then all the tools available and put them into action. And lastly, we need to make all of us accountable so that we can keep monitoring and then keep asking the tough questions so that ultimately we'll get where we need to be. Thanks.
Thank you, Anand. You highlighted this comprehensive approach. To be comprehensive, targets are there we have to achieve, but also we should not forget that we need to have a comprehensive approach to do everything that is needed to end TB. And also the role of data and monitoring and accountability and use of new tools. Let me go to Dr. Carl, if you can summarize your group, what you heard.
Thank you. I was also in the same group with my panelists from Pakistan. So she's mentioned most of the things, all of the things that were discussed. One or two things that I would like to mention for us this afternoon is one of the things that we have discussed is we looked at the targets. We have seen that in less than just 4 years, the amount of targets, milestones that we have to achieve is much more. we are looking at 45 million people to be diagnosed by 2027. So the group had a sense of urgency. We discussed that whatever action that needed to be done, it must be done now and it must be fast. We have to accelerate any action that we are doing at a country level, at a regional level, whether it's at a program level. So the urgency of the actions has to be accelerated, and we have to look at what we can do. We talked about within the boxes, but we also need to talk about outside of the box. We have to think about what is some intervention or someone that we have not engaged. We have looked at the usual partners, we have looked at the usual strategies, but is there something that we are missing? What else can we do so that we'll be able to engage everyone or put in the right resources to accelerate the responses that we are doing right now to achieve the NTP targets? And one of the among all the discussions that we have talked about, we talked about awareness, sensitization, financing, and targets, and all of that. So one of the things we know that the big money people are not attracted to TB. So what can we do to attract them to TB? We have to knock on the doors. Let's not just knock once and, when they say no, let's just give up. If we have to knock 100 times, let's go and keep knocking. We have to knock at the doors of policymakers. If there's a politician who needs to change the policy so that a TB response is favorable, we can be able to have the adequate finances, let's keep on knocking. There were one or two experiences that were shared that our group has to, keep knocking until what they want is seen. They're represented. The strategies that can bring interventions to have impact is actually included. Whether it's the community, coming from the community, touching included in the program, or maybe it's to do with policies. We have to keep pushing because as we note, we have only a limited amount of time to achieve great numbers that we have not done. And one of the things that we know that before we didn't have the tools, now we have the tools. We have the shorter regimens. We have even now the ultra X-rays. We have vaccines that's coming up. We need to make sure that those things are disseminated, decentralized even to the peripheral community levels so that more people can not just access diagnosis but receive treatment and be treated successfully. And then it stops at the door of finances. For us to bring those interventions to the community, we need the finances. So we have agreed that there's different ways we can get finances. For me, as a national TB program, my honorable member is already here. Our way forward now is the political will has to be in. So as a concrete step after this, we're going to work together with the TB caucus, do an investment case, raise the necessary political will that's needed to tie that will into a necessary investment so that we can raise enough investment to address TB. Without enough, massive finances, there's no way we can fast track on our responses to achieve the targets that we're actually talking about. And of course, World TB Day is coming up, so there's more people we can reach out with sensitization, awareness, whether it is with the politicians. For Papua New Guinea, we're going to have advocacy at the Parliament House coming month. So it's our way to reach our leaders, so they need to know how their TB is in their districts. How many of the people are dying from TB and what they can do. Like today, my honorable member didn't know that there are ultra-portable X-rays that he can put in his community. Now he's asking me, when can I get one? So that's a type of advocacy that I want to see in my country, and I think other countries can also do that. And also, I think one of the other things is that we can just learn from each other. If Philippines is saying that I've done it this way, it worked 100 times, I also want to know about that and do that as well. So that's basically what we discussed, and also from my country as well. Thank you.
Thank you, Dr. Kaul. You talked about higher targets requires accelerated action, very important. You also said that we have now better tools to fight TB, so we should be doing better. And also highlighted this idea of doing things not just in the box, what we have been talking about, but think about doing things which are outside the box. And also this thing about don't give up, the way you said, and also the political will is so important, and the investment case and the meetings that you are doing to create that, to build further on that political will. So now we go to Dr. Dazo. Your group, please. Yeah, what?
Our
Go
group
ahead.
is Group B.
Group E.
Yes. So for our group, we have developed 5-point commitment on achieving the UN high-level meeting on commitments on TB. But the fifth one, which is the civil society, which is us, no, the Philippine Medical Association, which is a professional societies, have already developed a 9-point commitment to end TB, because last February 22, in preparation for the March 24 World TB Day, we had a first Philippine Medical Association TB Summit. And to continue, so the first was targets and action, no? To be decentralized to the provincial or district levels, no? Action through decentralized plannings. We have good program of TB, no? But one shoe don't fit all feet, no? Meaning, we have to tailor fit. The program is already there of the TB elimination. But this program, we have to tailor fit to the needs of the identified community. No? Okay. Then, the recommendation also, point 2, population level screening using new technologies on TB infection testing and treatment with shorter regimen. No? Support regulatory ecosystem for agility as we have to adapt new technology. There was also a recommendation to remove sputum microscopy as part of the diagnostic test. But we have to replace it. No, we don't have to remove if there's no replacement. So the recommendation was to have a molecular testing. Okay? So, but I have to share with you, we have, in the Philippines, we are 7,100 islands. Okay? So, we have 1,600 plus cities and municipalities. So, imagine, we have 7,100 and only 1,600. So, meaning to say that island will have to ride a boat to have access to TB diagnosis and treatment and even consultation. Okay? Prepare for a TB vaccine introduction. So, but we have to put a timeline. Baka 2030 na, we still don't have the vaccine. Okay? And of course, the number 5 is civil society. As I said, we have, last February 22, we have this first Philippine Medical Association TB Summit, and I just want to share with you the commitment of the Philippine Medical Association through the national government to end TB. Okay? So this is will be our commitment. And join our local chapters. We have 121 component societies, no, of the Philippine Medical Association and individual members to actively advocate, disseminate, provide quality care to our patient and their families with or exposed TB through early diagnosis, provision of standardized treatment, and ensuring all patients are treated successfully. Next, actively be involved in the development of the DOH National Strategic Plan for Elimination of TB. Actively be involved in research and conduct studies based on the research agenda of the DOH National TB Program. Issues, advisories, policies among members in compliance with Rule 8 of the Implementing Rules and Regulations of the Republic Act 10767, which is the comprehensive TB law. And Rule 8 is about TB notification. No? We already have this integrated TB information system, but not all the members of the Philippine Medical Association know this IT, so we have to capacitate them. Okay? Next, actively support activities to notify diagnosed TB cases to the National TB Program by referring to private or public DOTS or DOTS facilities for registration and or treatment of directly registering privately managed cases in the integrated TB information system, espousing the ideals of honesty and accuracy in recording and reporting, utilizing prescribed forms and tools by the National TB Program. Keep a proactive stance in collaborating with other healthcare professionals or providers, the local NTP program, and other stakeholders in formulating and implementing strategies, policies, and procedures to screen all for TB, especially among patients with TB symptoms, exposed contacts, and identified high-risk clinical groups seeking care in healthcare facilities with or without symptoms. And the last three, employ the highest level of professionalism, integrity, and excellence when dealing with patients and their families while complying with international standards of TB care and NTP policies on screening, diagnosis, and treatment among patient-centered approaches. Agree or adhere to mutually agreed upon implementation process or procedures in referring and notifying presumptive and or confirmed TB patients. And last, maximize the use of developed information and education materials related to tuberculosis care and management. That's all. Thank you very much.
Thank you, Dr. Dazo. You not only summarized some discussions in the group, but also the commitment of the medical association is very important. You talked about many things, starting from decentralized services that fits the needs of the community to new technology, to vaccine preparedness, to civil society and all. And now we will go for the second round. And I will come back to you, sir, Honorable. This round is more about your own, not group, your own personal commitment that you would like to do some actions in 2024. You said you will mobilize the head of state, but anything on that or something else? We will have just maybe very short 2 minutes from each panelist. So if you can think about this question. So starting with you, sir.
Thank you very much. Briefly, what I intend to do for my district in a very practical manner for our fight against TB is to purchase, I've got 8 health centers in my district, a population of around 100,000 plus. I've got 1 gene expert machine in 1 health facility which we are using now, and it's doing wonders for us. And in that particular health facility, we've got 100% TB cure rate. I am now going to purchase 2 more gene expert machines to be placed in 2 more of my health centers, and we want to continue to do what we've experienced in the first instance that we did, which we have 100% TB cure rate. We're going to do it in the other 2 health facilities. And besides, I just found out that we have a portable screening X-ray machine that we can carry around. So I'm very interested to purchase that also for my district, and I'm going to talk to the people responsible with my health department to at least assist me to purchase this equipment for my district in our fight against this dreadful disease. Thank you very much.
Yes, I think that needs some applaud. I think very clear commitment of action. I was thinking about if you are committing to triple the number of expert machines from 1 to 3, right? So if that can be done in every constituency of all the countries, that will triple the numbers. In Philippines, it could go to 3,000-4,000 instead of 1,000, right? So that's a good concrete commitment, and also introduction of this X-rays, portable X-rays. Here in the meeting, you were not there on the first day, but first day some people actually got screened in such a device, not only portable, but the artificial intelligence giving the result to even ministers, and Ruchika was also there. So Janice, over to you.
Okay, so I'm representing the Philippine Coalition Against Tuberculosis, or PhilCat. PhilCat is an umbrella organization of around 70 governmental and non-governmental organizations, medical organizations, corporate and pharmaceutical organizations, lay and patient support groups, and even individual advocates representing the public and the private sector. We have been involved in many activities of the DOH, because DOH is one of our members, and one of this is our participation in the Global Fund project to engage the private sector in our country. So we have been doing that for many years already. One innovation that we have been involved in terms of case finding is our participation as the Secretariat of the Philippine Private Sector Consortium, Philippine Private Sector Diagnostics Consortium, or we call it Consortium for short. So this is a network of laboratories and hospitals in the private sector providing cheaper diagnostic tests for TB. So how are we able to do that? We actually pool the procurement of the private laboratories so that we can buy the kits at a lower cost, and so that they can provide it also to the patients at a lower cost. And these laboratories provide the test the same price. So all these laboratories, because in the Philippines, although we have local health facilities providing TB tests for free, not all patients from the private sector go there to have their TB tests. So another way for us to ensure that patients are tested is to provide cheaper diagnostic tests to the private sector. So another noteworthy activity that we are involved in is leading the commemoration of the World TB Day every March 24. And we are very happy this year that actually it's the Department of Health and our other partners that led the preparation for the World TB Day commemoration that we will be holding tomorrow. And we hope that you will all be participating in the formation of the human lung so that we can actually achieve a world record in the Philippines. So moving forward, PhilCat remains committed to its mission to put TB front and center in our agenda. We will continue to promote and support responsive public health programs, ensuring that all TB patients have access to quality assured rapid diagnostic tests, safe and efficacious anti-TB drugs, and a supportive environment of healthcare workers and communities that promote treatment adherence and provision of holistic care to manage malnutrition, smoking, alcohol abuse, diabetes, and of course another important disease in the country and in the world, HIV. So we hope that the private sector can continue to participate in the TB control program in the country, and that we will also be provided with the same support and funding from the government. Thank you.
Thank you, Janice. As a leader of PhilCat, which is huge in terms of the how you convene and your stakeholders in the group, important commitments on the private sector engagement in TB. And thanks for also being part of the event that we will see tomorrow, actually doing a lot of the background work behind the event. Thank you for that. So Kins, over to you.
So as soon as we go back, in partnership with the program and the Stop TB partnership, which is hosted by us in Pakistan, we're going to mobilize our parliamentary caucus, reactivate our parliamentary caucus, reach the head of the state, and as we say, inshallah, have our head of state invite you guys real soon. And our target is 2.2 million for the UNHLM until 2027. If we analyze, in the last decade, we were able to reach 2 million people with TB. Now we have only 4 years. So what got us here won't get us where we need to be. There needs to be concrete action. We have the right tools. We have One Impact, which has the highest access across the globe. We have done CRG assessments thanks to Stop TB partnership. We have our legal scorecard. We are doing the stigma assessment. Now it's all about action, 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 and accountability. We plan, we adapt, we act, and wherever, if we get stuck, we just tweak and adapt to the context. Now it's the time. We have to reach the last mile. And on 24th of March, we are hosting a marathon on the World TB Day, and we'll try our best to mobilize as many parliamentarians as we can. And together we can and we will reduce this deadly divide. We'll end this deadly divide and we'll end TB. Thank you.
Thank you, Kins. Great commitments for action. Very important in the context of Pakistan. You have a new Prime Minister, new leadership, new parliament. So we look forward to some exciting moments there. What you said is right. What got us here is not going to get us where we want to be. As you said, in the next 4 or 5 years, you have to diagnose and treat many more than what you have done in last 10 years. So thank you for that. Over to you, Shemaroon.
Thank you, Dr. Sehu. And for us, as a local NGO, as a partner, together with Stop TB Cambodia and our TB People Cambodia, we will work alongside with NTP. Dr. Yuda is here, and under the leadership of Ministry of Health, Excellency Dr. Mao is here, together with other partners, including stakeholders. We have lawyers here, we have celebrities, we have journalists. We continue to ensure that how can we better break the silence to make sure that TB, put into a high priority. And we will use a World TB Day, which we plan for next week, next Friday. And we expect that our minister will be there together with our local government, especially provincial governor, because our World TB Day under the leadership of NTP, we are organizing at the provincial level to bring attention, and we mobilize about 600 plus people where we celebrate the event, but also we bring diagnostic tool, rapid diagnostic tool there to community where we can offer the screening over 300 plus population during that event. In addition to that, like I mentioned, just repeat what Excellency Dr. Mao mentioned this morning. We need to work alongside together to ensure that how we can bring the partner with different expertise, with different resources, come together to support the country. So from global to regional, we will organize this kind of meeting in June to make sure of how can we mobilize our leader to take a very high attention on TB and ensuring that the country can achieve what committed in the political declaration, especially, Cambodia already made a lot of achievement, a lot of success, especially achieving MDG target for year ahead. And we also moving a lot of progress too in terms of rolling out a lot of new innovative tools. We have GenExpert, we use a 10-color GenExpert now. And so this is something that hopefully we can achieve what committed in the political declaration. In addition to that, several assessments that have been done through challenge facility support, including CIG assessment, the last mile population assessment, as well as costed CIG action plan that we've been working together with the NTP. We'll use that information as a reference to build awareness, but also important is to bring the attention of the stakeholder of how can we build a better partnership, a strong partnership to make sure that yes, we can NTB. Thank you.
Thank you, Jamroon. Besides what you said, the commitment, I think I would also recognize that if you look at the countries participating here, Cambodia is a complete team. You have Dr. Mao and the government leading the team. You have the civil society strongly represented. You also have journalists and a celebrity in that team. So I think that's the kind of multi-stakeholder engagement. Very good example. Yeah. Thank you. Thank you, Dr. Mao, and thank you, the team from Cambodia. And now, Anand, your perspective, yes.
Yeah, thanks, Dr. Sahu. So, I come from U.S. Centers for Disease Control and Prevention, which is a public health agency for the U.S. government. So we are basically the Ministry of Health for United States. And then one of the key partnership we have country offices, CDC country offices in about 42 countries, including countries which are present in this room: Vietnam, Philippines, Thailand, Indonesia. So I think we take pride in our partnership and working closely with our government counterparts. So I think as from CDC perspective, I think we are committed to continue those partnerships. Being a technical agency, we have a wide range of technical expertise from epidemiology, specifically in TB, the contact investigation. We focus on diagnostics, especially the proficiency testing, quality assurance, surveillance, data use. So I think from CDC perspective, we are committed to continue to work with all of you and provide support in whatever way we can, so we can advance the goal of ending TB. So we will play our role, and it's a bilateral relationship. So while we provide support, we also learn from you, because there are a lot of advances that have been done in many of your countries that we can take back to and inform our U.S. domestic response as well. So specifically, as I mentioned, proficiency testing, because diagnostic is important. There are a lot of new diagnostics coming up, so we try to adopt and evaluate any of the new tools, whether it is diagnostic or short regimens, but specifically the proficiency testing. And then, as I was saying earlier, surveillance and data use, I think it is going to be critical as we march towards the UNHLM targets. We have to, in real time, monitor those, analyze the data. There might be a need to pivot, make adjustments to the program. So I think from CDC perspective, I think I would say that we are committed to continue to work with all the countries represented here. And then from the US government PEPFAR program, President's Emergency Plan for AIDS Relief, there was a commitment made in New York that PEPFAR in the next 4 or 5 years will put additional 2 million people living with HIV on TB treatment and prevent 500,000 deaths. So I think from PEPFAR perspective, US government perspective, CDC, USAID, Department of Defense, it's an interagency response. So I think we remain committed to make sure that we can eliminate tuberculosis as the leading cause of death among people living with HIV. But again, looking forward to continue to working with you. As I said, we have country offices in all of your countries. So please reach out. We'll be honored to work with you and learn from you. And as our member of parliament said, I think it's good to be optimistic, but maybe Luchika next year we should change the slogan from yes we can end TB, that yes we will, or we are ending TB. Thank you.
Thank you, Anand. Thank you for the commitment to support countries in technical areas. And thanks to USAID. We also saw in the opening the commitment of USAID. The mission director was here. thanks to the US government for a lot of support to TB. We now go to Margaret. Dr. Carl, would you like to say something?
Thank you. For us from Papua New Guinea, the few things that are top priority for us, we have recently launched SSI, Systematic Screening for TB initiative in one of our Ibadan provinces. And the other case-finding initiatives that we have done in other settings, and we would like to accelerate this and work together with our partners. It would be good to approach CDC. We'll be looking at that as well very soon, and other partners, so that we'll be able to expand these case-finding initiatives and the different algorithms we want to expand to the provinces. We are also buying portable and mobile X-rays with computer-aided diagnostics, and we would like to expand those into the districts. I've heard now from one of my local members now is interested. Now I have a bigger assignment to go and convince other members to be interested. So in that regard now, I'll be working together with our technical partners to raise the investment case, and also I think there's a need for us to present to them the data for their specific provinces. So that's something that we'll be working in the next couple of days to reach as many leaders as possible, so they can also invest in addressing TB in their respective districts as well. We have endorsed SOTA regimens to be implemented. Next month we are looking at starting PIPA regimen in the country. So we are also looking at we've already endorsed the SOTA TPT regimens as well. So we'll be very soon calling in all our officials to approve the SOTA regimen for drugs susceptible TB. So when the tools are available, we would like to not just introduce but scale up and expand to the rest of the country. Thank you.
Thank you, Dr. Carl. PNG has done a lot of work in the last few years in TB response. I think you now have heard your member of parliament and also the plan to mobilize the head of state. So your people are fully behind you on this. So thank you for your commitment. Dr. Dazo, over to you.
Okay, good afternoon again. 2030 is fast approaching. Okay. So we can end TB if there is a collaboration or working together with the public and private sector. And we in the private sectors, as I said a while ago, we just had our first Philippine Medical Association TB Summit, and we have committed a 9-point commitment to end TB by 2030. So what the PMA will do now is to have a strategic planning in order that this 9-point commitment will be concretized and become operationalized in the grassroots. We have 121 component societies. No? And I hope that by the end of this year, we will be able to roll out this commitment of PMA to our national government to end TB. Thank you.
Thank you, Dr. Dazo. And thank you for also reminding us that very few years to go to 2030, 6 years to go. So we heard the panelists, great commitments from very diverse perspectives here. And also they captured the discussion that happened even in more diverse the group settings. So thank you for all of that. A lot of actions, personal commitments. So we are capturing them, and there will be a report out, and we should follow up on this. I hope the countries can do a similar activity at the country level. I think some of you spoke about it, to get all stakeholders behind the UNHLM commitment and do the actions that are needed for achieving them. So before ending, I think people said here, yes, we can end TB, but also said, yes, we will end TB. So if everybody is with me, can we say both of them at least once? So, yes, we can end TB. Yes, we will end TB. Thank you. So, so I am requested to keep the panel here, or do we? Okay, so you can go step down. One picture.
Is this working? Yes. Okay. So we have the closing session now. I would say that it's a great honor, it's a great pleasure to do this closing for two reasons. First is that there is a large group that also speaks a lot there. Can you please... Okay, thank you. I wanted to say there are two reasons to do this closing session and be so excited. First is that we have, on a Friday afternoon, after a week full of meetings, a room very full, because this room is very large, you know, this is a room for 400 people, just for you to know. So we are a very large number scattered around. But more important than that is that we have with us the Minister of Health of Philippines here with us in bones and muscles. And as you all know, sometimes that's very rare. And I also want to recognize in the room few of our big champions, starting with you, Mr. Eiji, from the Ministry of Health of Japan. Thank you so much. And we have with us the celebrities from Pakistan as well as from Cambodia that were also staying with us for so long, as well as the MP, the Honorable from Papua New Guinea. Thank you so much, sir. And of course, all our friends, the TB survivors and civil society and communities, as well as the technical partners, funding partners, private sector, and everyone journalists, and everyone that I see my friend here from Cambodia, and everyone that I forgot, I apologize. It's very rich because we have all these categories represented. But for this closing, I have a very big privilege and honor to invite Secretary Herbosa to share a few thoughts. You can speak from here or from the lectern as you wish. So, sir, please go ahead.
Thank you, Luchika. And of course, I'm probably the happiest person here because for several days, TB has been in the limelight. And since last year, since we had the UN high-level meeting on TB and all the side meetings on TB, I was actually impressed with the global movement, especially the Stop TB partnership with the private sector, the different countries, and the people, the passionate people Even during the high-level meeting, they gave me a red scarf to wear. This scarf. I was wearing that as I read my Philippine statement in the UN General Assembly on the high-level meeting for tuberculosis or TB. And with everyone here together, with the patients included, the different countries, I see no reason why we cannot end TB. So the reason here, the passion, that is the collective passion in the room. Luchika said, what is it? Skin and muscle and bones. Yes. You forgot the heart and the brain. I think what I felt the whole several days is really the heart and the passion of the people who have flown and come all the way from their different home countries to come here, to share, to discuss, to talk about how we can end TB. Whenever there are a group of people with a similar dream, it becomes a goal. When it becomes a goal, it becomes actionable. And when people act, we get there. So I think I'd like to thank you all for traveling all the way to the Philippines, experiencing the hot weather in the Philippines, but staying in rooms like this, discussing with other people. I just hope that the networks that we have developed in the past few days will continue as collaboration and more productive work in our dream to end TB. So maraming salamat from the bottom of our hearts, from the Department of Health, together with my colleagues. Can you all guys stand up, the Department of Health people who are still here? Let's all give them a big round of applause. My Undersecretary for Public Health, Eric Tayag, is also here. Thank you so much for making this happen. It's not easy to put together a meeting like this, especially with all the coordination. We still have one more thing to do. You know what that is? We need to break the Guinness Book of World Record. So that's tomorrow. I think what's going to happen, is someone going to discuss that so that people know? They presented it. They presented yesterday. So I think basically, if it's the registration. That's why they want people to come early, because the Guinness arbiters, the arbiters that are looking at it, are making sure there are no people added, but that the people who come, and at a certain point they will stop counting. So if we make the 8,000, I think before 9, they will already declare that we have broken the Guinness Book of World Records. So I plead you all to wake up early, be part of this historic event, the biggest human lung formation for TB. If we can break Guinness Book of World Records, we can actually end TB. Maraming salamat. Thank you very much.
So, 2-3 things to close completely. First of all, really, it's our hope as well that most of you will be with us tomorrow in this momentum. As I said yesterday, you know, we have some opportunities in life to make a difference. And it's because we are in certain positions or in certain places, and let's use them. Because when time is passing, we will always say, I could have done that, and I didn't do it. So, you know, it's not that every day, you know, we are planning to break a Guinness World Record for TB. It's actually, to be honest, the first time that I am involved, engaged, aware, and so passionate about it. I know that some people fly home, so have a good flight. Don't cancel that because it costs money. So we cannot afford to cover that. But those of you staying here, I understand around 60 from this meeting will be tomorrow. That will be our contribution in numbers towards the 8,500 people. I also said that in Romania we have a practice when we want to fill a room for different important political leaders that are not happy that half room is ready, you just run around and take whomever and put in there. So we can tomorrow have a squad on the streets in Manila and bring people. We need to break this record, so whatever it takes. I don't know what we do, but we have to break this record. So I hope you are coming tomorrow in large numbers. Now, the last two things that I want to say is this, and I will stand up as a matter of respect for the minister, for all of you in the room and so on. This was the first regional meeting that we had in 2024, and we are so happy that we did it in Manila. And we are, yes, thank you. For so many reasons, and for the fact that everybody here is so kind and nice, smiles, wants to help, you feel welcomed, you feel embraced, but also because there is a huge work and push on the TB response. That's what is beyond the beauty and the nice. From this dialogue, as you realized, there were several groups discussions, we had all these panels, and we had 3 topics that we look at: the awareness, financing, and UNHLM. I think it will be good for those of you that can, it will be really great if you can consider having similar type of gatherings at national level, similar type of dialogues, and bringing what we tried to bring here, not just government or not just civil society, but a wide range of stakeholders, because to fight TB is not just a matter of one category, or it's not just a matter of Ministry of Health. It's not just a matter of even the different ministries. It's a civil society issue, is a private sector issue, is a parliamentary issue, and people, survivors, celebrities, journalists can just add, will add and will push from different directions for things to move. So let's don't be naive in thinking, oh, if the government is on board, things will change. Absolutely not. Or if the civil society is there, things will change. Absolutely not. Together is a different story. And it's not easy to be together, and there are moments in which there are frictions between the different groups, doesn't matter. Doesn't matter. The importance of it is to really move forward. So consider of having similar type of dialogues at national level, if it's possible, for countries having challenge facility grants, Stop TB partnerships, or also any other type of grants from us in Stop TB. You can use that to have one of this type of meeting, a national dialogue. We from Stop TB will continue with this regional dialogue in the other regions, and we will use the lessons learned in Manila, and we will refer a lot to Manila, and we will use the way that it went to push forward. Today, sir, just to let you know that we had an amazing panel on financing that Austin moderated here. We had the Asian Development Bank with us, unbelievable speech, great commitment to do an MOU. That's not that important, but it's important for work with Stop TB, but also to look over $1 billion to go into TB in the area. Very committed and unbelievable efforts, and I want to thank my colleagues Srinivas and Sahu for facilitating the Asian Development Bank engagement, because I don't know how you got that guy, but he was spot on. So from this meeting, my colleague Greg, that is there, and he was the happy winner of our team. Greg, maybe you wave a little bit. Yay! You know what, Greg is the happy winner of putting together all the points of all the panels and all the discussion, and have a crisp 2-3 pages of Manila actions on awareness, financing, and UNHLM, that we will, not only that of course we will share with you to polish or to add things, but also to see and have a benchmark for this region and see, are any of these ideas, plans and dreams and suggestions that we had there becoming a reality. And some of them will become, some of them will not, but this should not stop us at all. We have to go ahead. And we have to go ahead with the head up. And 2024 will not be an easy year. We have to do better than 2023. 2023, you will see, was probably the best year in the history in terms of access to diagnosis and treatment for people. Probably the highest number ever of people with TB being diagnosed and treated in 2023. Now, 2024 should be better than 2023. And we should keep growing till we reach all these people with TB diagnosed and treated. And then this has to be maintained for several years to start seeing the impact. And it has to add interventions on prevention and all the other components around the people support and that are in need there to really see a decrease. So it will not be easy. The fight for the money is not easy. Next year we have the Global Fund replenishment, Gavi replenishment, GFF replenishment. The funding donors are like, oh my God, where do I put my money first? But let's try and be smart together and put money into things that help TB as well as other components. I think with this, I don't want to stay long because we promised very good, close it please, for God. If I had some mental disorder, I would have now a crisis because I have a blinking, can you close the light? A blinking light in the face here, so me and Minister are like, yeah, a seizure, yes. Anyway, now that there is no seizure risk, I want to thank very much to everyone. We are very honored that you were here with us. There is still some coffee break, sweets served there. There is an opportunity to take some photos. We are earlier than we expected, but we are very grateful, and I want to thank you all very much. And I think we should take a photo. We should have several people on the stage as well as in front of the stage. Thank you very much. Have a good flight back. And those of you not, tomorrow morning at 5:30 a.m., we are all breaking a Guinness World Record. Yay! Thank you. Let's have a photo all together. Is it possible to move this? Is it possible to move this? Hello?